they are deleting this working formulation of grading of the lymphoma, which is required clinically. So there was clinical schemas that are proposed to recognize the biologic behavior and the cell of origin of the lymphomas. So clinically, they have tried to classify the lymphomas in the three categories: the indolent lymphomas, with untreated survival measuring in years, or aggressive lymphomas, there's untreated survival measures in months, and highly aggressive lymphomas, untreated survival measures in weeks. So we are trying to classify the lymphomas on the clinically in three categories. So indolent lymphomas, they are basically arising, they are frozen at the stage, not normally replicating. Basically, they are at the mature stage, but maybe circulating. Diseases are slow accumulation. There is there is defective apoptosis. So the cells are not dying. There is slow accumulations of these mature cells. So often widespread at the diagnosis, prolonged natural history, median survival is more than 5 years. We usually respond to chemotherapy or radiation therapy, but there is a relapse, and again response to alternative therapy. But currently it is incurable disease unless it is localized disease or bone marrow ablation is done with stem cell transplantation. But in contrast, the aggressive lymphomas, that is intermediate and high grade, they are frozen at the stages characterized by replication and accelerated growth. So disease of defective cells, they are basically disease of due to defective cell cycle control. More often they are localized at the presentation than the indolent lymphomas. They are more than extranodal. The shorter natural history, median survival is less than 2 years, and requires the aggressive therapy to achieve the clinical remission, and there is disappearance of the all detectable diseases. Despite the short natural history, curable disease in some of the aggressive therapy. Approximately 30 to 40% of the adults, they have curable disease, and 50 to 80% of the children, they have curable disease with aggressive therapy. And all childhood lymphomas are usually of aggressive type, like Burkitt's lymphoma and diffuse large cell lymphoblastic lymphoma. They are of these aggressive lymphomas. This is the classification of the lymphomas, indolent and aggressive, based on this clinical behavior. Indolent lymphomas, they are usually small lymphocytic lymphomas. The indolent lymphomas, basically they are comprised of mature lymphocytes. So they are morphologically, they are very small lymphocytes, just like small lymphocytic lymphoma or CLL, chronic lymphocytic leukemia, follicular lymphoma, of grade 1 or grade 2, not the grade 3, because grade 3 has large cells, plastic cells. Then the extranodal marginal zone lymphomas, nodal marginal zone lymphomas, splenic marginal zone lymphomas, air cell leukemia, lymphoplasmacytic lymphoma, plasma cell myeloma, plasmacytoma, cutaneous T cell lymphoma, and cutaneous CD30 positive anaplastic large cell lymphoma. Then the aggressive lymphomas are PLL, large B cell lymphoma, mantle cell lymphoma, anaplastic large cell lymphoma, and all peripheral T cell lymphomas. And highly aggressive lymphomas are the plastic cells. They are like Burkitt's lymphoma, plasma cell leukemia, precursor B cell leukemia, precursor T cell leukemia, and adult T cell leukemia. So based on this clinical diagnosis, the chemotherapy is chosen. This is the clinical staging of the lymphomas. It defines the extent of the